Welcome everyone. We are very excited to have you all for today's partner retreat, for the 2021 partner retreat. Today, we have several guests that we're really excited about and get to discuss Medicaid expansion and how we as a state can potentially better address basic health needs through that expansion. We have with us a graphic facilitator, and her name is Sarah Goon. She's from the Ink Factory. So throughout today, we'll be changing between screens, and she'll be displaying sort of a storyline that is said throughout the meeting. So really excited about today's event and having you all with us and learning from so many folks in our community that are doing really wonderful things to address the basic health needs of our community members. So to start us off, we have several folks who are in leadership at the Health Sciences Center and through OSCTR and the OCTSI. There's lots of alphabet soup around this. But today we are greeted by Dr. Tim VanWagoner, as well as Dr. Stephen Crawford. And they're going to open us up. And potentially Dr. Zubialdi will be joining us here momentarily as well. So Dr. Crawford, I'll hand it to you. And Sarah, I'm going to stop sharing my screen so you can share yours.
Thank you, Hallie, very much, and welcome everyone to our partner retreat that's addressing Oklahoma basic healthcare needs and how we're doing that through Medicaid expansion. I do want to let you know that I've been in communication with Dr. Zubialdi, and he's been delayed momentarily, so as not to delay any other the process. I'm going to proceed on, but if he gets on, I'll defer to John to make the welcome, who is our executive dean at the OU College of Medicine. I am the senior associate dean at the OU College of Medicine. I'm also co-director of the Oklahoma Primary Healthcare Improvement Cooperative. That is, we affectionately call that OPHIC in its abbreviation. It is the parent organization to our partner group. Our partner is advisory to our Primary Healthcare Improvement Cooperative, but we're also part of the Oklahoma Translational Science Institute that Dr. Tim VanWagoner is the administrator for, and he'll be making some comments here in a few minutes. But we do want to emphasize the purpose of this meeting today, and that is to better understand why Medicaid expansion is important, how our state will deal with that in regards to both health systems and support that needs to happen to improve the overall health care of our state. And we want to emphasize those points. We have some wonderful speakers to review those efforts that are ongoing at this point. We're very excited that our healthcare authority that runs the Medicaid agency is doing a superb job of enrolling and getting health care available for many of these new enrollees that haven't had the opportunity to have supported health care for many years. And we know that that's going to be a particular burden for our state's health systems, but an important one so that we can and improve our state's standing in regards to healthcare systems. One of the things that I do want to emphasize is that we know through many studies that primary care is an exceedingly important part of healthcare in any healthcare system, whether it be in the United States or in other locales. And we want one of the things that hasn't happened over many years is the support for primary care, infrastructure support. And that is one of the things that we'll talk about more with what we do in regards to OPHIC. But with that, I would like to turn it back to Hallie. And should we go on to Dr. VanWagoner to speak on how our Translational Science Institute fits within this whole picture?
That would be great. So we'll open it up to Dr. Tim VanWagoner to tell us a little bit about OSCTR and OCTSI. So the alphabet soup, please.
Yes, we wanted to just kind of give you guys a little bit of an overview of all of this because it can be kind of overwhelming, all the acronyms and terms that we might use along the way. So the Oklahoma Clinical and Translational Science Institute was founded about 7 or 8 years ago with a mission to serve as a catalyst for clinical and translational research here in Oklahoma to help improve the health and the healthcare of our populations, with a particular focus on our underserved and underrepresented populations, including rural areas of Oklahoma. We also provide a lot of clinical and translational research training and infrastructure with the goal of helping develop, from here in Oklahoma, the capacity and to be able to do research here. And then also from an equity perspective, to expand the opportunities for Oklahomans and our communities to participate in research that would then help improve their lives, because they have every right to be involved in research just because they don't live within close proximity to Stanford or Duke. We have a lot of major programs as part of the OCTSI itself. You hear the term OSCTR, or the Oklahoma Shared Clinical and Translational Resources. This is the big NIH grant that provides the infrastructure behind the OCTSI. It's been a little over $40 million in funding from the National Institutes of Health, specifically for that infrastructure. We have other things, including clinical trials units, a national pediatric clinical trials group. But OPHIC really is what this meeting is really all about. And the Oklahoma Primary Healthcare Improvement Cooperative was developed from the work that was done by the OSCTR and the Department of Family and Preventive Medicine here at OU HSC, and was founded in order to help work with the clinicians and communities here in Oklahoma to help advance what we refer to as dissemination and implementation research in the state, with a goal of bridging the gap between knowledge and actual practice in medicine. So how do we do that? And so we've had a lot of really successful grants that we've been able to acquire for that. It all started with Healthy Hearts for Oklahoma about 5 or 6 years ago, a grant from the Agency for Healthcare Research and Quality, in which we helped more than 250 small primary care practices throughout the state to improve their the cardiovascular care for their patients. That's transitioned to an innovative program called Do No Harm, which helped to address the opioid epidemic in Oklahoma, with a particular focus on trying to help practices reduce the use of opioids and better manage the pain of their patients. That's led to a current grant we have, again, from the Agency for Healthcare Research and Quality, called Rise OK, and that's a specific opioid reduction program targeted towards elderly patients. We've got other programs that have been funded by the state through federal sources to address screening, brief intervention, and referral to treatment for substance abuse and depression and so forth. And then a timely one that we're in the midst of right now called Catch Up, or the Community Engaged Approaches to testing in community and healthcare settings for underserved populations, is a program in which we are helping practices in rural areas of the state to deploy and properly use point of care testing for COVID-19, and as well as community-based interventions to help our partners throughout the state to hold COVID-19 testing, serology events, and so forth, all together with the goal of trying to understand better what are the barriers to COVID testing, including from the practice side, and then barriers for for individuals to get testing, as well as to better understand how the pandemic has affected the citizens of Oklahoma. So with that having been said, I'll now turn it back to Hallie and Steve, and but that hopefully gives you a little bit of an overview of the sort of things we do at the OCTSI.
That's great. Thank you, Dr. Wagner, or VanWagoner, excuse me. We are so grateful that Dr. Zubialdi has joined us. Without further ado, I really appreciate hearing from Dr. Zubialdi, who is the Executive Dean at the OU College of Medicine. Grateful for your time today.
Well, Hallie, thank you so very much. And to all of our participants today, it's really a pleasure to be with you. It's great to actually hear from Dr. VanWagoner first, because I think this is a great overview of our Oklahoma Primary Healthcare Improvement Collaborative and really the importance of the work that's being done to help partner with our state in order to really advance several goals, not only improving the healthcare of our state, but also bringing the kind of research that's necessary to help achieve that goal, as well as assuring through our educational programs to make sure that we actually have the workforce that's available to help achieve these goals as well. And they're all the primary reason that we are here as a university and as well as a College of Medicine. It really is only, however, through these collaborations with our partners throughout the state that we can achieve these goals. And again, as you've heard from Dr. VanWagoner, the work that's being done is really based upon those kinds of collaborations. So what we're going to be doing today and hearing today from the participants in today's program is just another great example of how those partnerships work and how we can have conversations and collaborations that really help bring all of these pieces to the forefront. So again, it's just a pleasure to be with you. We are so glad that you are a part of our Partners Collaborative to help in this work, and very grateful to the work that you do each and every day for the people of the state of Oklahoma. And again, look forward to the further conversations, and thank you all very much for being with us.
Well, thank you, Dr. Zubialdi. We are really lucky today to also have Dr. Daniel Duffy with us. And I'm going to share my screen real quick to introduce Dr. Duffy. He's going to be talking a little bit about the history of Partner and kind of how we evolved as a community advisory board, patient clinician advisory board for OPHIC and OSCTR and all of the other alphabet soup acronyms that we use. So Dr. Duffy is the professor emeritus and former director of OPHIC, so the Oklahoma Primary Healthcare Improvement Cooperative, and he's going to be talking about that history. And then I'll be following up with a bit more of Partner today, just talking about membership, and then moving into some goals and objectives for the day. So I'm going to stop sharing, and Dr. Duffy, you should have control.
Thank you very much, Hallie. Can you hear me?
Yes, I can.
Terrific. Well, it is indeed a pleasure to be here and to be pulled out of retirement to participate in this. We used to call these summits. We're now calling them a retreat. And they are a think tank for Partner. And I think over the 6 years that Partner has been in existence, these summits or retreats have been a statewide think tank that has really helped inform the OSCTR, the OPHIC, and the University of Oklahoma's multiple colleges, including the School of Community Medicine in Tulsa, on how to become more engaged with our community's needs. So let me just say a little bit about the background. Partner is a concept of our founder, James W. Mould, who is the named person in the Primary Healthcare Improvement Cooperative, or OPHIC. We call it the James W. Mould OPHIC. And Partner is the clinician, patient, academic and community service roundtable that its purpose is to advise the Oklahoma Primary Healthcare Improvement Cooperative projects, the leadership, and to keep abreast of are the services that we're offering to help quality improvement in primary care really meeting the needs of the people of Oklahoma. Our tagline is working to foster the best use of evidence, practice, and patient wisdom in Oklahoma's primary healthcare system. And that's the genius of Partner, that we have this very broad-based, community-oriented input into the planning and execution of our projects. Partner is the name of an advisory panel that guides the work of the Primary Healthcare Improvement Cooperative, as I've already said. And as Tim has pointed out, the cooperative is an initiative of the University of Oklahoma Health Sciences Center focused on strengthening the state's primary healthcare delivery system by supporting continuous quality improvement in primary care practice using the cooperative extension principles. Just a diversion here, the cooperative extension is the agricultural cooperative extension that is now 103 years old now, that has been extraordinarily successful in moving our agricultural world in the United States from requiring 60% of the population to produce our food to about 6% of the population through advanced research and dissemination of that research in agricultural principles to farmers throughout the state. The same principles are now applied in the Oklahoma extension, primary healthcare extension system, in which we have field agents, if you were, who take the research that comes from the medical research institutions and brings it into practice. The cooperative extension not only strives to advance practice, and in our case, primary healthcare, but also binds those efforts to community-based health improvement efforts aimed toward shared goals. And that's the big difference here. Partner attempts to bridge this gap between the practicing community, which is very medically oriented, and the health services delivery community or public health community, which is focused on the health of the population and has those two communicating together through the advice of Partner. Partner brings to this overall enterprise the valued perspective and guidance of primary healthcare users, and that's really important. Patients are on the Partner Council, as well as clinicians, and they work in partnership with academic researchers. For its members, Partner represents an opportunity to participate in a process that will over time improve the quality of primary healthcare delivery in Oklahoma. And it is that participatory engagement that is most rewarding to the people who serve on the Partner Council. The Partner charge is to represent the voice of the community and guide and support the mission of the James W. Mold Primary Healthcare Improvement Cooperative and its funded projects. Its also role is to advise the OPHIC staff and researchers on ongoing and needed efforts to translate research into practice and practice back to research questions that can be solved in the research university. And lastly, the Partner will act as a resource to OPHIC and its funded projects to strengthen the community partnerships aimed at advancing knowledge and translation and speeding the dissemination and adoption of evidence-based innovations. The membership of Partner has changed a bit over the initial plan, but it roughly is a 16-member board and has 8 persons or families who represent the consumer, the patient within healthcare. And we attempt to have patients and provider dyads so that they can speak from a personal experience of how they receive their healthcare. They should have a broad knowledge of healthcare and are willing to speak up, representing the patient's voice, not only their own personal issues. And our participants who have been patients or consumers of the healthcare system have been just absolutely spectacular over the years. Then we have 8 community clinicians or academics who understand primary care practices at the community level. And that's the really important thing. This is not focused on the finances or regulatory processes of healthcare delivery, but the role of the primary care clinicians in the community. They have to be open to incorporating research findings and have an interest in quality improvement in general. Most importantly are our community partners on Partner, and we have had and do have people from the academic institutions, OU and OSU, from TU, from the payers. The Healthcare Authority is an important member. Blue Cross Blue Shield and other payers have been important, as well as healthcare systems, in addition to individual private practices. Last thing I'll mention is the activities of Partner. Partner does its work through quarterly meetings in which the advisory panel meets. Used to be in person, but through COVID, we've been meeting by Zoom, and it's been really very effective. And review and advise the OPHIC leadership on individual projects. Tim reviewed these for you: the Healthy Hearts for Oklahoma, the Do No Harm, Better Pain and Opioid Management, SBIRT, the Integrating Primary Care and Behavioral Health, Catch Up for COVID testing, and H2O Plus, the Diabetes Improvement Program. What has been most impressive to me, however, has been what we're going to do today. And these are the Partner Summits, which I've always thought of as unbelievable think tanks of all the various constituencies, from the legislative representatives, public health services, public agencies, insurers, health systems, physicians, social workers, the entire gambit of people who are involved, including the patients on Partner, who are involved in the health of of Oklahoma. And these summits create an opportunity for a very broad public-private conversation about health without any access to grind. And that they have been spectacular. And we've had them focusing on quality improvement in primary care, social determinants of health, and community cooperation and collaboration. So with that, Hallie, that's the brief introduction of the history and what Partner is all about, and I'll turn it back to you.
Great. Well, thank you for that. And yeah, it's always so wonderful to get together and learn as a group and share ideas. So the virtual space is not quite as conducive as the in-person space has been in the past. To that, however, I do think that we have an opportunity to hear from some really wonderful speakers. And please, if you can stay for as long as possible, that would be ideal, because that's then the opportunity to hear from the larger group of folks who are on. And we'll be sharing several things after this meeting so that we can continue to have the collaborative discussion around who's been engaged. And we'll be sharing these notes that Sarah is so brilliantly taking right now, as well as the recording of this. So really just grateful for this group here. As Dan mentioned, Partner is a group of folks who are from several different places across the state. And I'm going to just quickly share my screen so that you can see the current members are individuals who are from several different locations across the state in several different capacities. So just kind of throwing their names up here. They have been tremendous providers of insight around their own lived experience, as well as programs and opportunities to strategize for OPHIC, for enhancing the implementation research that's been so critical from OPHIC, as well as the OSCTR and OCTSI. I'd also like to just quickly note what our objectives are for this meeting. And basically, we're going to be talking through the current expansion work. So creating a shared understanding of where we currently are with Medicaid expansion. Then we're going to move into a discussion and talk about what is happening in other states, particularly in Arizona, around how they, through their Medicaid expansion, are addressing basic health needs. And then we're kind of revisiting Oklahoma's current work and looking at what is currently happening here in the state, and what is working in the state. And then lastly, we're working with you all to prioritize social determinants of health in order to help focus efforts moving forward.